Hi everyone, happy Women's Day. Welcome back to iMumz Women's Day week. We've had a power-packed week with so many insightful discussions over the last week. But today we have two very, very important personalities joining us as a grand finale. So without any further ado, I'll just quickly introduce them. So, our speaker for today is Dr. Jadeep Malhotra. I would personally like to introduce her as the co-founder of iMumz. I think many of the moms would have attended some of her sessions, but for the new users, she's one of the co-founders and behind the idea of iMumz app. She is a very renowned gynecologist and obstetrician with she's delivered more than 10,000 babies is what we know, so many more to come in future. And ma'am is also a past president of the Indian Gynecologist Association. So welcome to the session, ma'am. We are very excited to listen to your discussion on holistic approach. And our guest speaker or co-chair for today's session is Dr. Yvonne Diaz. She is a renowned gynecologist and obstetrician from Colombia. She is currently a professor as well in two universities there, and she's currently the chair. She's the chair of the Reproductive and Endocrinology Society of the World. So, like international organization for reproductive health. So, welcome to the session, Yvonne. We are really looking forward to this discussion between you both. And to all the users, you must be wondering, why are you talking to your baby? Why do you have to listen to music? Why is it important to meditate? So Dr. Jaideep will share her insights on why and how we framed this and why it is important for you. Over to you, ma'am.
Thank you, Ansuya, and a very good evening to all of you, and good morning, Yvonne. Thank you so much, for being there. This is a wonderful platform where we share our thoughts and we inspire pregnant women, because whatever time we are going to spend during pregnancy, it's going to build up two future generations, and that is where the whole thought process is all about. So I'm going to, in the first few minutes, build up the base for your understanding. And before I do that, a very happy International Women's Day to all of you, because you are the pivot, you are the fulcrum on which a family, a society, and a nation revolves. So for you to be strong, for you to be healthy, for you to have a clarity of thought is the most important thing. And that is why this app and this talk is all about. Because we are talking about pregnancy. Now, why are we talking about pregnancy? Why are we talking about holistic approach towards pregnancy? Because a lot of times we have realized that as soon as everyone gets pregnant, it's like a big disease which has happened. And we stop enjoying the moment. There are so many stressors. We start digging amongst ourselves. Oh, this is a problem with me. This is a problem with that. Why am I having this? And that's something which builds up the stress. And then the family also, don't do this. Please keep lying down. Eat this. And that also sometimes, gives stress to all of you. And this stress can have many kinds of problems for you and also for your baby. And for me as a gynec and an obstetrician, again, loads of problems, because if you are stressed, your baby is going to be stressed, and the baby is going to have different kinds of gene expression, and then the other kinds of complications which can happen. And plus, I'm not happy if you're not enjoying your pregnancy. That is something which I want all of you to understand. Now, think of me as a obstetrician, and think of us as in India. We have almost about 30 million babies being born every year. And there are only about 100,000 gynecologists who are looking after them. Some of them are still delivering in the house. People who are on the app may not realize that. But what has been really worrying all of us was that we were losing too many women during childbirth. Like everyone used to say, no, it's a second life. When you get pregnant and when you deliver and when you come out of that delivery, it's like a second life. And this is why we used to call it as a second life, because we were losing almost about 212 women for every 100,000 deliveries. So that was a huge number. And we are all debating on how to bring it down, because that's something which is very important. Your safety is very important, but it's not always a doctor is responsible for that. And that's something for all of us to understand. Today we are at 113 after a lot of things which we have done, but we are not able to go down below that because there are many other issues which we need to understand. Now, similarly, the infant mortality, we were losing too many babies immediately after neonates, like immediately after birth, and also immediate in the first 5 years. And that was again something which was very, very, I would say, it used to really stress us a lot. Now, let us also face the facts. Like, imagine that in the world we are having 130 million births. Can you imagine? Out of them, half of them are anemic, the mothers. Their hemoglobin is down. Almost around half of them are obese, or their weight is more than normal, which should be there. Then about 1/4 of them are malnourished, and about 1/4 of them have diabetes, and about 8 million, I would say, just about 10% or so, have high blood pressure. Now, can you imagine all of these are going to have a lot of impact on the mother and on the baby, and then on the whole society and the doctors and the fraternity and the health status of our future generations. And that's something which we have to understand. So what we did, we started propagating that every woman who gets pregnant should deliver in the hospital. Now, once we started doing that, this mortality or came down, but it still did not come down to the level which we really were expecting. So then it made us think that what is wrong? Where are we going wrong? Why are we still not able to control? And then we realized that we had too many of those non-communicable diseases, hypertension, diabetes, obesity, and other things which we had, which were contributing to this mortality not coming down. Now, in India, I would like all of you to understand that our problems are even more different. Why? Because in our country, all these problems are coming at a younger age. Like normally, these problems would come at 55, but in our country, they are coming at a younger age. Plus, we are the diabetic capital of the world. We have the maximum number of diabetic population in the world. We have the maximum number of preterm or premature babies in the world. So if you see here, we are heading on the top. 68% of our under 5 children who die are because of maternal and child malnutrition, because they don't get the right kind of diet. And we also have many malignancies, or I would say cancers, which are rising all in our country. And that is something, again, we need to understand that why is it happening? Because there are many contributory factors which are there, so we have to understand. So when a pregnancy happens, so everyone thinks that, oh, I'm coming from a good genetic background. Like if you say, like this is a tree here, and this tree has come from a seed. The seed of this tree I give to 10 people and say, okay, please go back and grow this tree in your own gardens. Now, every seed will not come out as big or as robust as this tree. Now, you may wonder why that is happening, because this is a seed of the same tree. But the environment in which this seed grows actually also dictates how this seed will grow into what kind of a tree. So we need to understand that there is something which we are carrying as a genetics, and there is something also like our environment which is all around us, which will dictate on how we will grow or how our children will grow. Now, let me give you an example. There's so many things which are all around us, our environment, the plastics, the pesticides in the vegetables which we eat, the preservatives, the sanitizer, especially for this COVID, which we are using, the air pollution. Now, all those are not under our control, you may say, but they are directly or indirectly under our control, and they all produce obesity, diabetes, thyroid, and other things in us. Now, you may ask me, what can you do? Now, if you are exposed to all these, what I was talking, environmental factors, during when the baby is there in your womb, there can be a different kind of a gene expression in the baby. And the baby can have more gene expression for cancers, obesity, diabetes, and so on. If you're exposed during puberty, then it has different kinds of problems. And similarly for adult life. And we never think like that. So that is something I want all of you to think about, because all what we thought about in pregnancy was the doctor would give us a folic acid, and if there is a deficiency of thyroid, we would take, thyroxine tablets, and that's it. But it's not so, because today we understand that there are lots and lots of contributory factors which are there in our pregnancy, which will dictate on how my child or my future 2 generations are going to be. Now, what is healthy? If I ask you, which is a healthy mouse in all of these, you may say, oh, this one which has a golden, coat and all those things. And if I now go back and tell you that this is the mouse which he is obese, this mouse is more prone to diabetes and more prone to cancer. And this is the one who's actually healthy, because this has the right kind of genetic expression which happened when this mouse was in its mother's womb. Second very important thing, that today what the mother eats, like today I would say what I am today is what my grandmother actually was exposed to, whether it was diet or the environment or so on. So sometimes I feel very privileged. Oh, my grandmother had better environment, which I am not providing to my children and to my grandchildren. So there are a lot of things which we need to understand when we are pregnant. And then we also need to understand and control whatever we can. And that's something which is very, very important, because there is something called genetics, and this is environment is something which I'm calling today is the epigenetics, which also can become inherited by our children. Why am I talking and giving you this lecture? Because I can tell you that women who are under stress, women who don't eat well, women who don't really, who are very depressed or anxious, in their children, there will be different kinds of gene expression which can be very detrimental to their health. Now, the stresses only cannot be mental stress. The stress can be undernutrition, where you're not eating well, overnutrition, or you're too big or obese, you have high blood pressure, you develop diabetes during pregnancy. All these will have a poor pregnancy outcome. And then you can't go ahead and blame the doctor that, oh, my pregnancy did not do well because of you. And that is something which I really want to educate all of you. Because even when you are undernourished, the baby is going to have diabetes, hypertension, and insulin resistance and heart disease. Even when you are overnourished, then also the baby will have all these problems. So an ideal nutrition is something which is very important. Many of us don't go to the doctor. My mother-in-law said, oh, don't go to the doctor till you have finished your 3 months. Now, if I tell you that if you go after 3 months, it is too late for the doctor to bring about any change in reducing the birth defects, in reducing your chances of having high blood pressure, in reducing the chances of you having diabetes or, all those things. So what is the right time to go to the doctor? The right time is to go before you start even thinking of in a good future for your children. You have to understand that you have to plan your pregnancy, go to the doctor in the preconception period, and then follow her advice or his advice throughout the pregnancy, even postpartum. And if we do that, then we will be able to reduce the disease and disability and the complications which happen in our pregnancy to a larger extent. So, what is the right time which will have the maximum outcome as far as a good pregnancy is concerned and the good future generations are concerned? I would say 12 weeks, 3 months before you get pregnant to about at least 8 weeks after pregnancy, because that is the most dynamic period in a pregnancy. After that, there will be a lot of other psychological changes, the personality development which happens, and a lot of these other problems like diabetes, gestational diabetes, which we talk about, gestational hypertension, we talk about, all those will come a little later. But if you start well, then your chances of having a pregnancy and a healthy future progeny are going to be much better. So whether mother's weight is important or no, yes. If the mother is low weight, then the chances of having a growth retarded baby, preterm delivery, malnourished, iron deficiency anemia in the baby are going to be much higher. If the mother is obese, and then her chances of having gestational diabetes, blood pressure, preeclampsia, birth defects, chances of not delivering normally, and the baby also having diabetes, hypertension, and cardiac disease is going to be much higher. It's not only the mother who's responsible, fathers are also equally responsible. So, if the father is fat, then the chances of the baby having diabetes or impaired glucose tolerance test, what we normally say, are going to be much higher. So we need to understand that both the father and the mother are responsible for what the outcome of this baby is going to be. It's not only that. I can tell you that if you develop high blood pressure during pregnancy, then your chances of having heart disease, kidney disease later on in life are going to be higher. So pregnancy actually is a test which will tell you what is coming in future, so that you can modify your lifestyle and you can bring about the changes which will reduce all these. Similarly, if you have diabetes development during pregnancy, then rest assured in the next 5 years or so, if you are not careful, you will develop diabetes and also cardiovascular diseases or the heart disease. So you need to be careful. Similarly, if we have a preterm baby, now you must understand if the babies are born premature, those babies are also likely to have cardiovascular heart disease, no matter what their birth weight may be. So this is really, really important for us to understand that all these things which I have talked about have an impact at birth and plus on the life which has to come or follow later. So where am I coming now to? I'm coming to that pregnancy is one window of opportunity for all of us, whether you as a pregnant woman or as a doctor, which gives us, like 1 year to look after ourselves and then to take some actions which will reduce us suffering from all these diseases later on, which will reduce our children suffering from all these diseases later on. And that's something very important. And apart from that, not only that, also the psychology, the neurocognitive development of our children, the personality of our children, the foundations are all laid down in the mother's womb. So if you know that, what I am telling you right now, I must tell you that knowing is not enough. We must apply it. And willing is not enough. We must do it. Like, or some of you may be on the obese side, or some of you must be having hypertension or diabetes. But if you know what corrective measures you have to take, and if you're not taking, then it is going to impact not only you but your future 2 generations. And that's something which we have to understand. So this is something I was just trying to tell you here, that there are 3 important phases in life. One is before you got pregnant, then during pregnancy, and then post pregnancy. Because post pregnancy also is very important, because we need to give time to the baby, breastfeed the baby properly, do all the immunizations, and take all the contraceptive measures so that the next baby does not come before at least 2 years before um, this one has had your attention properly and your body has recovered. So if I'm a good doctor, I will tell you all that what I have told you. But if you're a good mother, you will now take these small opportunities, because these small opportunities will actually lay down the foundation of much greater achievements as far as your progeny is concerned. So what are the things to focus on? Preconception counseling, you must go if you're planning to. Second important thing is that the first trimester or the first 8 to 12 weeks is the most important one. So follow your doctor's advice, do all the tests which are recommended. All these things are there on our app. We will tell you. And also, a DIPSI test is very important. Take all the immunization, which is important. And plus, this is another very important thing which I want to tell you is newborn screening. Because we do a lot of tests in the early part of soon after birth to screen the babies so that some of these, like let's say hypothyroidism, if you don't do the test, you'll never find out congenital hypothyroidism. So you must understand that these tests need to be done so that the baby's growth can be monitored and brought out well. So I would urge all of you that don't look at short-term benefit. Short-term benefit of getting pregnant and delivering safely. You have to look at a long-term benefit. And long-term benefit is that you must have a healthy baby. Because once you have a healthy, positive baby, the life of you and your children is going to become much better. And as a doctor, why am I worried? I am worried because I want the future generations to be healthy and wise in every possible way, because that will become, and that is where the need of holistic approach towards pregnancy.
Jadeep, excellent your conference. Congratulations. For FIGO, International Federation of Obstetrics and Gynecology, is very, very important this work around the world in preventing for to have pregnancy healthy in non communicable diseases, because obesity, hypertension, diabetes is the most frequently diseases for to high risk and pregnancy. And of course, in our committee in reproductive medicine, we work all day for preventing, of course, the infertility, but to have a pregnancy healthy. Um, eh, I have a few questions because it's many important. It's very very important to understand about your conference. Uh, how we can, or why we need to look after pregnancy in a logistic manner, because the, all your conference is very important, because we need to prevent all these diseases when one woman have a pregnancy, obesity,
Mm,
hypertension,
Dr.
diabetes.
Yvonne, sorry to interrupt. I think Dr. Jaideep just lost her connectivity. Please give us 1 minute and I will connect her back.
Okay,
Yes?
perfect, no problem,
So
no problem.
sorry. So sorry for the interruption.
Okay.
Yvonne, until she joins, would you like to take over and speak a little about how things are in Colombia and how are you guys taking pregnancy in a
Of course.
holistic way? So our
Okay.
viewers want to listen to you. Yes.
Okay, no problem. Okay. So thank you very much for this invitation, and for my country is very excited to be here with you. Colombia in South America is not far for your situation. Of course, we in Colombia the population is about 13 million people, and our mortality, maternal is about 17 for 100,000 deliveries. Um, uh, of course, we have the many problems in the health. Is the same to the Indian. We have here obesity, we have hypertension, preeclampsia, diabetes too. We have an security social healthy. We covered all population with our government. All women in pregnancy is covered in the security social for the in the hospital, and every woman have can to take a delivery in the hospital near its house. Um, we need to make every day the prevention about the preeclampsia, diabetes, obesity in the periconception and preconception. And that is very, very important to learn all the women of the world the important to have a healthy pregnancy in the future. We call all the women now today in the International Day of Women. Congratulations for every woman now is now connected for to have a healthy pregnancy in the future. That's the most important is consultation to the doctor for your point, for your measure and body for prevention and to have pregnancy healthy. Jaideep, congratulations for your excellent conference. It's really, really important today in the day of the world, in the day the woman of the world international. Congratulations for every woman in connecting now. And the most important for the woman is the pregnancy, because we, our future at the world is so for the woman, and we are this responsibility. We need a have a pregnancy healthy, and I have few questions. I have few questions, Jaideep. Many few questions about your excellent conference.
I think again she is
Yeah, yes,
having
I
some
see.
network issue.
I see, I
Yes.
see, I see. And
Yes.
here in Colombia, all time we look for the good nutrition on every woman before the pregnancy and during the pregnancy. Of course, for in Colombia we have the law about the about the all the prevention for the woman in pregnancy. For example, the anticonception, the contraception, if one woman have diabetes and hypertension, is we need to have the medication for the hypertension, for diabetes, and after that, the woman can to feel for to have a pregnancy. No before, because it's not possible to have a pregnancy with this morbidity, because one morbidity is most frequently mortality during the pregnancy or after the pregnancy. I don't know what happened in India, but here in Colombia, in this last year with pandemic, we rise our mortality maternal rise index, because with the pandemic, the woman in pregnancy no go to the doctor with the frequently need for the of course for the same of you the possibility to go at the doctor with the pandemic year. I don't know what happened in India this year with pandemic, but in my country the rise the mortality maternal is very rise. Now we have approximately 16 and 17 by 100,000 delivery. But 3 years ago, we had 45, 15 for 100,000 delivery. So I think the pandemic is rising this index mortality, no prevention, no go to the doctor, no good nutrition, no good prenatal consultation, and I feel that is very, very important for to achieve in this topic. Jaideep, I would like to, for example, hear the question in the forum in this important interview. Why we need, for example, why we need to look after pregnancy in a logistic manner, and how can we achieve this? Because the most important is the how we can achieve. Is very important. Yeah. Your exposition, your index, but is the manner sample for the doctor, for the woman, for the all the world. How is your possibility?
Yeah, thanks, Yvonne. I think what we need to understand is that initially in our country the maternal mortality rate is much higher than yours. As I told you, like right now we are sitting at 120 per 100,000, and our SDG goal is about 70. Yeah. And what we realized was that almost more than a decade back, we urged every pregnant woman to deliver in the hospital or institutional deliveries. And with that, we brought that down. But after a certain time, now we are stagnant. We are not able to reduce it further. And now today, most of the reasons for maternal mortality are not sepsis, hemorrhage, what we were thinking about. But today we have diabetes, hypertension, the obesity and other things. Now, those are some problems which women have to look after themselves. And even when they look after themselves, and that is why I was talking about that every time we have seen a obese woman or a hypertensive woman, when we write a prescription, we give her some advice, she's not able to follow. And I want to explain to them that if you don't follow, you're going to suffer, but your future children and your grandchildren are also going to suffer. So you are laying the foundation for future 2 generations. And you need to look after. And with these nuclear families happening now, and we still don't have universal coverage of health. So in India, initially, if you would fall sick, the joint family people would take care of you. Now everyone's living alone and you still don't have insurance, then who's going to take care? So we need to take care of ourselves. Now, how can we reach? Either they come to the doctor or the awareness goes to them. So that is where this iMumz app was made. And this app, actually, our Prime Minister has honored us with a 2nd position in the app challenge, because this is having long-term impact on the future generations. So I would, and this is we are going to go global, launch, very soon. And in India, we have it in various languages now, so that we reach out, because India is a huge country. In every 200 kilometers, there's a different language. So you can't really make people understand because there are like 27 languages which are being followed. So we are going to convert this app into different languages so that we reach out to many people.
Okay, okay, perfect. Okay, Jaideep, you know now in the world and in the journal publication about how we can to help the woman in the pregnancy by many ways. And one way is, for example, in the, meditation and the other ways, for example, for to help this woman. How does meditation help in this woman in the pregnancy?
See, very important is that we understand my mental health actually dictates the gene expression in the baby. If I tell you that if I, as a pregnant lady, I'm stressed and I have different kinds of stressors, like, sometimes the stressor can be, as I said, maybe I'm not getting enough to eat, which, India, such a big country, half of the population is rural. Sometimes I have things to eat, but I don't know what is right for me. That also gives stress because I'm not eating the right kind. Sometimes I'm eating more. Sometimes the environment around me is giving me a lot of stress, which I'm not able to cope up. So, meditation helps you strengthen your brain into coping up with stress. And that's a huge exercise. And this meditation, you don't have to do it for a long time. 10 to 15 minutes in a day. And on the app, we have guided meditation sessions. Like, we have teachers who basically teach these women to meditate, stay calm, so that once they are calm, all these genes to be expressed of all the diseases which I was talking about are going to be much lesser. So, after 2 or 3 decades, we will understand that the problems of all these diseases have gone down a lot. Plus, the personality, the aggression in our personalities. Like everyone, they have their temper here on their nose. If I say something, everyone's ready to boil down. Now, staying calm, self control is something which meditation teaches us. And that is something which is good for our health and also for everyone else.
Exactly, exactly. I agree with you because this is very very distress the pregnancy, of course, all around the woman, but we can help. We can help with the meditation. Every woman in every house can have an side and a special space for this meditation because it's
Yes.
very important. It's very very important.
Yes.
And for the nutrition is of course very important too. But we know during the prenatal consultation every month we need, for example, to see how rise the kilogram the woman. Normally 1 kilogram by month, maximum 9 kilogram during the pregnancy. But the how we can to, for example, to get that guidance, the good nutrition. How is the good nutrition and how to get that guidance? You can to talk about that.
See, what happens, Yvonne, is that especially I would talk about my country. Now, in India, there are different kinds of foods which are available. The variety is a lot, and every household has a certain pattern. Now, if you are obese, and if let's say 2 or 3 people in your house have a weight which is much higher than normal, that definitely tells you that the lifestyle and the food which is being cooked in your house is not exactly what should be a healthy food for your family. Now, this time during pregnancy, if you educate yourself, you're educating the child inside, and plus you're educating the family outside, and you're reducing a lot of other problems which will come out with obesity. So let's say if you're obese, if you have put on too much weight, your chances of having gestational diabetes are going to be more. Your chances of hypertension, your chances of malignancies are all going to be more. So, but the problem which happens is, how do I know what to eat? Because my grandmother said that, or my mother-in-law is telling me this, eat, don't eat that. But what does the evidence say? What should I eat? So there is plenty of help available on the app where you can give your food preferences. We calculate the diet chart and the number of calories which you're supposed to eat during that period, and tell you what should be the optimum weight gain. If you're gaining too much, then the dietitian or the nutritionist can actually explain to you that what to avoid and what to eat. But sometimes there are other questions also, like let's say I'm just giving you one example. In India there's a big myth: papaya, you should not have papaya, otherwise you will abort. Now that's not true. And so many of the women have constipation, and we tell them, you have papaya. And they say, no, doctor, my mother in law told me not to have papaya. So now all those myths are also broken down, and we explain to them, yes, green papaya, don't have.
Yeah.
But ripe papaya, you can have. If you're diabetic, don't have bananas or mangoes, or have an apple or the fruits which are less sugary. So these are the kind of day-to-day advice which you get on the app, which no doctor can provide you. That's something which is the beauty of the app.
Exactly. In my country, it's the same. The same. Papaya is we could say about the a good nutrition every woman, and here in country we have a law about every woman during the prenatal consultation have the possibility to see the specialist in nutrition health, and the government covered this consultation, but the woman no go because is I think is no agree because the most important is the food, the mother conseiller, the family conseiller, but it's not through the professional in nutrition. So
Yeah.
that is very, very important. In my country, that's the same in your country, Jaideep.
Yeah.
Very, very,
Yeah.
exactly. And
We also have a few queries from the users, if you don't mind.
Sure, go ahead, ask us.
So, uh, a few users are feeling a little anxious about after hearing, after seeing the presentation. Probably I'm too late, and what did I do? So, ma'am, what do you suggest for them?
Oh, you know what, Ansuya? It's never too late. First thing is that you may be a little late in making changes for this pregnancy, but at whatever stage of pregnancy you are, do the desired changes which are required. Okay, because at least it is not going to push you to the corner. It's going to bring you better. First thing, which is important. Second important thing is that today you are more empowered and educated. Supposing this is your first child, you know what changes you have to bring in your second pregnancy. You are empowered to educate people around you. Now today's Women's Day, and we were discussing that women have to empower women, because most of the times what happens is that we pull each other down. Men push us down in a very different way, but we also have to understand that once we together with knowledge and with camaraderie, we going to educate all the women around us and empower them in a big way, so that all these stressors, whether it's nutrition or the changes in our lifestyle or the changes in our family atmosphere, they all need to be as happy, as positive as can be, and this will give us a lot of confidence.
yes.
Thank you, ma'am. Moving on to the next question. Uh, how to keep yourself positive during your entire pregnancy? I become very anxious and furious over tiny things. So, how do I maintain my calm?
Yvonne, would you like to take this question, or?
No, it's okay. You can to respond.
Okay. So see what happens. My grandfather used to tell me sometimes when I used to get upset. So he would tell me, see, if you're showing somebody that you're upset or you're anxious about something, it's going to happen more often. Now, if you start counting, like so, sometimes we get angry and we start responding immediately. Now, we don't have to do that. If you're angry from inside, just start counting 1 to 10, which is a normal phenomena, or start saying your prayers, or move from the place and go to your special place, which Yvonne was talking about. All of us have a special place in our houses, which, and a special time. And you just go and you can say your prayers. You can listen to the music which is there on the app. You can close your eyes and just think positive, because what we have to understand is that happiness is a state of mind. Happiness is not something which, like, somebody will provide you. You need to be happy in all the circumstances you have. Now, one example which I normally give to all my patients is, when we are going on the road, when we are crossing, there are beggars on the road. Have you ever seen anybody crying? No. So you have to understand that we need to be happy in whatever circumstances we have, and we need to be the change which we want to see in the people. So first thing, I will become positive, and then the people around me will become positive. So that is the biggest learning I have learned, and I will ask all of you to do that.
Exactly, Jaideep. I would like to talk about a few, because every woman when have a pregnancy is the most important most important in your life, because only the woman have to have pregnancy, not the man, only woman. And when I see one patient, I all time I told him about provide your pregnancy, life your pregnancy, the best manner, the best way, because the woman pregnancy work on their tables many people can to show, can to down in one day. No, because the pregnancy is very stressful, is dangerous, hypertension, diabetes, mortality. So the pregnancy is many important for every woman, and life through pregnancy the best manner, and the meditation, the happy, all time, the night mode, every day, life the best way.
Yeah. You know what? Just about a few days back, one of my patients came to me and she said, Doctor, I'm carrying my husband's baby, and my husband doesn't really take care of us. I expect him, to speak some nice words to me, bring me a cup of milk, or take me out for an ice cream, which I really look forward to. And he doesn't. I said, the, there's another way of looking at it. Can you just tell your husband that, dear, I'm carrying our baby. Can you? And the baby is asking for an ice cream. Can we go for an ice cream? The baby is asking that, where is my father? Tell my father to talk to me. And she came back just a few days back and she's saying, Doctor, my life has changed. So there's a positive approach towards how you do. Instead of, cribbing and complaining, if you just start putting things positively, it's going to be a different world altogether.
Yes.
Absolutely, ma'am. So well explained. You mentioned about the diseases being passed on to other generations. So Sumit's wife, she is 6 weeks pregnant, and his father-in-law, wife's father, he has hemophilia, and it is a genetic disease. So is she prone to transfer it to the baby? Like, is there any test that they can do right now at this early stage to know?
Is she expecting? See, first of all, we need to sort of find the problem in her, if she is a carrier or no, or the husband also is a recessive carrier or no, and then take a proper genetic advice. That is important, because these are certain things, these are genetic diseases, they need to be dealt on a proper platform in a different way.
Thank you, ma'am. So Smriti says, I was initially very happy, like in the probably the beginning phases of pregnancy, but now she feels depressed most of the time. So how to maintain this balance? Like you said, look, like it's not always probably easy for them to look for the positive. So is there anything that you would suggest to
Yeah,
her?
the most important thing is that as our pregnancy grows, I feel like women basically are lazy. They are chronically mentally fatigued with many things which are happening in our life. And if you will notice, I'm sure I may be wrong totally, but this is what I have experienced in life, that whenever there is a chance, they would like to lie down and feel very tired and all those things. Now, a lot of times, the family comes in cribs, that she keeps on lying down all the time. And I can tell you, the when you start exercising, whether it is even a simple walk, whether it's a little bit of yoga, the endorphins which are generated from there, they give you energy. When you start meditating, the kind of production of all positive hormones which happens are important. But if you lie down and if you sulk, then the depression mounts, keeps on mounting. So I always tell people that in case if you're feeling very depressed, the best way is, either if you're in a later stage of pregnancy, do your meditation, go for a walk, even like people who swim, and do some kind of an activity, but do not brood in your bed. That's very important. And it's a constant exercise which you have to keep on doing all your life. It's not only for pregnancy. Pregnancy gives you a little, excuse to lie down. There are a lot of times, these mother-in-laws and the husband will complain, doctor, she's always lying down, whatever opportunity. And the pregnant woman says, I don't get time, I'm overworked. Now, but more than physical overwork, it is a mental overwork which needs peace and more calming. And that is where meditation and yoga really help.
Yes.
Thank you, ma'am.
And another comment. In International Women's Days, Figo talked about numerous chose to challenge it. Every woman can choose your future in the pregnancy, can choose and have a pregnancy healthy and happy your pregnancy. That is the very now is today is very important in International Women's Day. You can to choose and you can do decision. Is your decision.
Yes. Yeah.
I think we'll take up the last question, almost running out of time. I'm 19 weeks and 5 days pregnant, and I conceived via UVF. My USG shows low-lying placenta. Now, this is like a physical condition. Probably they were not expecting it, and I'm constantly worried about it. So, can you suggest some do's and don'ts and ways to deal with this anxiety?
Yeah. See, most of the times, these sessions, we normally do not expect medical questions, but I'll address it anyway. Because when placenta is something where actually the baby goes and sits initially, and as the uterus grows, it gets pulled up. Now, what happens that if it is really low down and the uterus keeps on growing, if it's there in the center, the uterus is growing, but the placenta remains down, that is something that we need to take a lot of precautions for. By, let's say, 24 weeks or so, most of the placentas which are down will go up. They migrate up, they get pulled up with the uterus. Now, if that happens, then you are just normal. But supposing if it stays down and it is covering the mouth of the uterus, then you need to take precautions, and maybe you will not deliver normally, and maybe your doctor also needs to take certain precautions while delivering you. So you need to understand this, then avoid very extensive workouts, avoid having sexual contact with the husband, avoid lifting big amount of weights and all. And those are the things, because there are chances sometimes that you may bleed. But majority of the patients, or the majority of the pregnant women, the placenta migrates up. So I would say don't take unusual stress on this, because this is just a natural phenomena. But yes, if we normally tell you so that you're able to take the extra precautions and you don't do certain blunders which might lead up into some bigger complications. That's all. But I don't see any reason for you to worry about it, because worrying is not going to help you. It is not going to go up with your worrying. So that is something which you have to understand.
Thank you so much, ma'am. I think we have come to an end of that insightful discussion. And I think our users will meditate, will do yoga, probably take a walk after dinner today. So yeah, everything to stay healthy and move in the right direction for the future generations. Thank you so much, Dr. Yvonne, for being such a great co-chair for this session. And we were really looking forward to it. And even at a short notice, you were okay to come and join us early morning, like it's 8 a.m. I think there. So thank you very, very much. And to all our users, happy International Women's Day once again. And we hope you stay healthy, happy, and continue bonding with your baby.
Thank
Thank
you.
Thank
you.
you. Thank you so much. All the best. God bless you all. Thanks,
Bye.
Yvonne. Thank
Bye.
you.
Thank you.